Sir, namaste, sir.
Yeah, namaskar. Yeah,
Sir,
go
good
ahead.
morning, all of you. Andy. Sir, మన జూనియర్ కాలేజ్ CEOs, ప్రిన్సిపాల్స్, అట్లానే ఇంజనీరింగ్ కాలేజీ స్టాఫ్, స్కూల్స్ స్టాఫ్ అందరూ కూడా అరౌండ్ 60 మెంబర్స్ ఆన్లైన్లో జాయిన్ అయి ఉన్నారు సార్.
Okay.
మనకు వచ్చినటువంటి అంటే ఇక్కడ మాకు సర్క్యులేట్ అయినటువంటివి ఏంటంటే 2 టైప్స్ ఆఫ్ వ్యాక్సిన్స్ ఉన్నాయని, కోవిషీల్డ్ ఒకటి, కోవాక్సిన్ ఒకటి. ఈ ఆక్స్ఫర్డ్ యూనివర్సిటీ దీంతో పూనా డెవలప్ చేసింది కోవిషీల్డ్ సార్. కోవాక్సిన్ ఏమో ఇక్కడ లోకల్ భారత్ బయోటెక్ డెవలప్ చేసింది. ఇవి ఫ్రంట్ లైన్ వాళ్ళకి 1 crore ఫ్రంట్ లైన్ వారియర్స్ కి, 2 crores సెకండ్ కేడర్ వాళ్ళకి, 3 crores కి ఫస్ట్ స్టెప్ వ్యాక్సిన్ ఇస్తుందని జనరల్ పబ్లిక్ కి ఇంటిమేషన్ వచ్చింది సార్. ఇక్కడ ప్రజెంట్ పొజిషన్ సార్. దానికి సంబంధించిన డీటెయిల్స్ వివరాలు అన్ని కూడా మమ్మల్ని ఎడ్యుకేట్ చేయండి సార్.
Okay. Yeah. Can I start or?
Yes, sir.
Sir, you can start, sir. Please start, sir.
Okay. Raju, I sent you some slides. Do you have those slides?
Yes, sir, I have. I will open.
Okay. 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 I will ask you, and then you can show the slides. Okay.
Okay.
Okay. Yeah. So, Raju, can I start then?
Yes, sir.
Okay. To all respected staff members, I thought it is very important from a public service point of view to spend this time to educate or to share the information, not to educate, to share the information, so that you also can share the information to all the people that you know, like your family, your relatives, and the people that you come across, so that everybody understands how important it is to participate in the vaccination as a service to save yourself and to save others. Number one is to save yourself, and number two is to save others. And even in the most developed countries, there is still a significant amount of population, like 30 to 40% of the people, that have some trepidations or that have some doubts whether they have to vaccinate themselves or not. And most of those doubts, they are reasonable and they are genuine questions. And if they understand the answers for those genuine questions, then people will participate more in number and make themselves safe and secure, and make the society safe and secure. I can go over a few slides, okay, like 5 or 6 slides, so that you will understand the basis of how a vaccine works, why you should be vaccinated, and I will also cover what are some of the genuine questions that the public has about vaccination, and in particular, corona vaccine, because it has been developed in record time. So people have their own doubts about the genuine nature of the vaccine. And then I will give a significant amount of time for each of you to ask questions that you have about vaccination, so that I will try to answer, and then we all can satisfy ourselves uh, and feel safe to get vaccinated. To start with, I got myself vaccinated, and I have myself vaccinated the 2 doses, and I personally did not have any side effects. And I mean, it was not any different than the flu vaccine. So my personal experience is very good, safe, and I'm extremely happy to get vaccinated. Okay. Raju, can you go over the first slide, please? Raju, can you
Sir,
share the first slide? Huh?
Are you able to see the screen?
Yeah, I am able to see the screen, but it says Umapati Raju. There's no slide on the screen.
I'm sharing.
Okay. Share screen, it says. No, I'm not able to see it. Others can see it?
No, sir.
No, sir.
No, sir.
No.
రాజు నాకు పంపిస్తావా నేను వేస్తాను.
Okay. Yeah, I can see the first slide, Raju. Okay. I just want you to see only one point in this screen. All you have to remember is the spike protein. Okay, because that is what most of the times when you hear about coronavirus, they talk about the spike protein. And you can see the spike glycoprotein. That's all you have to remember that. Okay. All other things is beyond people who are not into science and medicine. Just remember spike protein. Okay, next slide, please. Next slide. Raju. Raju.
దామోదరం చేద్దాం.
సార్ ఇప్పుడు కనపడుతుందా సార్?
No, we are not able to see. Send it to Rambabu. He says he can share it. Okay.
రాజు ఇప్పుడు కనపడుతుంది రాజు.
Yeah, I can see the first slide. You want me to operate on the second slide?
Yes.
No, I can't operate. You have to go to the second slide in the power.
Okay, sir.
Okay. Dear staff, understand when you have seen the first slide, all the time when we are talking about teaching learning, I always talk about relevant recall of relevant material, recall of relevant prior learning. Like for example, it is hard for you because it is science, it is hard for you to understand. But when you, yeah, I can see the second slide, Raju, that's good. But when you can think in lay terms, okay, like virus can be equated in lay terms to a thief or to a criminal or to a dangerous individual. When you think about a thief, what are the dangers with him? The dangers is you are afraid of his hand because his hand can hit you. That is the danger part. But how do you recognize the thief? When you have to recognize the thief, the police will use his thumbprint as a specific tool to recognize a particular person, or iris, that is the eyes, as a specific tool to recognize him. The thumb and the iris are not dangerous, but they are very specific to a specific person. That you can understand because you have you have a knowledge about this particular thing in your past. When people put a thumbprint, that is that thumbprint is very, very specific to that person only. With that thumbprint, the police can recognize that person in millions and millions and millions of people. And also, when you are passing, a, a instrument can recognize your iris and say that you are Ram Babu or your Kodeshwagar or your Prasad Gar or your Raju. Okay, just like that, the body, when it develops antibodies, can recognize in millions of viruses that this is the virus that is attacking me. Coronavirus is the one that is attacking me, or rabies is the one that is attacking me, or measles is the one that is attacking me, by recognizing a specific part of the virus which is not dangerous. Okay, so when you recall our relevant learning, what we have learned in the past. In the past, we have learned that you can recognize by a specific part of a of a structure, even though that that particular part is not dangerous, like the thumb and the iris. Like that, the same is applied into the vaccine physiology also. What is a vaccine? Vaccine is one that when it is given, after a while, when the injurious event happens to you, your body can recognize that injurious event and can neutralize it by an antibody, that is by a police. A criminal can be neutralized by a law abiding officer like a police or any particular person can relating to that, who has the knowledge, he can recognize and neutralize the criminal. So vaccine can prevent an infection by recognizing that. Number two, vaccine, when it is given, when you are immunized, that means when a lot of people in the community, majority of the people in the community are immunized, it is very difficult for the disease to spread because people have the protection. Number three is when most people are vaccinated, then there are certain people who cannot be vaccinated, who are who have multiple other diseases like severe congestive heart failure, severe lung disease, or any immune compromising illnesses. They cannot be vaccinated, but they will be protected because the disease cannot spread because most of the people are vaccinated. So three uses. One is your personal use. Two is it makes, when everybody, majority of the people are vaccinated, it makes the spread of disease difficult. Number three is for people who cannot be vaccinated are still safe because the disease cannot spread because most of the people are vaccinated. So three uses for vaccine. Next slide, please.
Okay.
Okay. How vaccines work? Just going back to your prior learning. When the police is trained to do something, to catch thief or to do a specific thing, then the criminals can be caught. Just like that, vaccine greatly reduces the risk of infection by training the immune system. Okay, how does it train the immune system? It trains the immune system by exposing it to a very harmless substance to create a, a defense or an antibody or a particular thing against what you are giving, and make that to recognize the dangerous object and neutralize it. So vaccines safely deliver an immunogen. Immunogen is a criminal in layman terms, which is specific type of antigen that trains the police. That means how does police get trained? They have criminals, and they are they are given weapons that are not dangerous, and police can train against those weapons and prepare themselves when the criminal with a real weapon comes. That is how a vaccine works. Now, next slide, please. Okay, this is a big slide. I don't want you to look at all the things. I want you to look at number 2, wholly inactivated virus. The mechanism of Covaxin, okay, the mechanism of Covaxin, that is the Bharat Biotech vaccine, is a wholly inactivated virus. That means they take coronavirus that causes the COVID disease, kill it. That means the whole virus is killed. Okay, no part of the virus is left out. The whole virus. The virus has 27 proteins. All 27 proteins will be there in that killed, but it is not active. It is killed. They insert that killed vaccine into a green monkey kidney cell. That is their platform. Green monkey kidney cell. That is their platform. They put the virus in that cell and give it as a vaccine. And when it goes inside the body, it develops antibody. I will show you another picture, then you will understand. It develops antibody, and that antibody will be able to recognize when coronavirus enters your body and kills the coronavirus. And look at the one that is last before, replicating or non-replicating viral. The Covishield, that is the Oxford virus, is a cold causing virus. Just means like in winter you get flu. They take that virus and put the part of the DNA of coronavirus into that virus and give it. So it is a adenovirus, that is a cold causing virus, but attenuated. That means it cannot cause cold. It is only as a vehicle it is given, and then it goes inside the body and then creates an antibody. Okay, only these two things remember. One is a wholly inactivated virus, which is the Covaxin, which is inserted into a green monkey kidney cell. The other is a part of the virus that is attached to cold causing virus, adenovirus. That is the Oxford virus, that is Covishield. Okay, next slide, please. Next slide. Okay. Uh, okay, just 1 second. Okay. If you look at the right side of the slide, it says coronavirus peptide. That is either the monkey cell or the cold virus enters the body and initiates several steps, but the final step is the coronavirus peptide. If you look at the right side of the slide. Okay, this is the vaccine from a whole virus. That means this is an example of Bharat Biotech Covaxin. Okay, the whole virus is killed, put it into a different cell, and it is given, and it goes and initiates series of steps. And the final step that you have to remember is the coronavirus peptide. Next slide, please. Next slide. Okay, here it is a protein-based virus vaccine. Again, after all the steps, the final step is the coronavirus peptide, and that initiates an immune response. Whatever the mechanism, whether it is wholly inactivated virus, whether it is a live inactivated or attenuated virus, or a peptide virus, or a protein subunit virus, or a a vector that is like an Oxford vector virus, or an mRNA that is the Pfizer and the mRNA vaccines that are available in the US right now. All of them with different mechanisms, the final path is to create a coronavirus peptide. That means a coronavirus peptide which the body recognizes and produces antibody for that. And that antibody recognizes coronavirus when coronavirus enters your body. Next slide, please. Okay, this is mRNA. Again, the final step, if you look at the right side of the slide, is coronavirus peptide, and that coronavirus peptide initiates the immune response or antibody production in the body. Whatever may be the mechanism, the final step is that step, and that is what the body uses to develop antibodies. Next slide, please. Next slide. Okay. So this is an important slide for people to understand so that their questions can be answered. Usually, for vaccine to be developed, it will take 4 to 5 years. And why does it take that long a time? It takes that long a time because initially it has to be tested in animals. That is called a safety test, and also to test in animals to see if it works. That is called effective study, efficacy study, safety study, immune response study, efficacy study. That means when you give it to 100 animals, rats or mice or rabbits or monkeys, and when you expose them to the virus, how many of them develop the illness? First is you have to see whether it is safe or not. Two is you have to see whether it develops antibodies or not. Three is after the development of antibody, when you expose it to the virus, how many of them develop the illness? So safety, responsive study, and efficacy. Then you go into normal human beings, that is phase 1. Okay? And in phase 1, you will see safety. When you give this, is the person developing any side effects? Is the person developing any high fever or any other problems that should not be there? Then they will study in humans to see if response is there, if antibody production is there. Then in a smaller number of people to see how many of them, when given the vaccine, can develop illness. That means when you vaccinate them and when you expose them to virus, are they developing illness in a smaller number of people? That is called phase 2, like in 1,000 people. Then phase 3, in large number of people. Okay, like in the case of coronavirus, they are testing about 30,000 people. So animal studies, phase 1, phase 2, phase 3. Phase 4 is when in general population. That means when they are giving to people like all of us, are we developing any problems from the vaccine? So in order to do all these things, it takes 4 to 5 years. That is, they are done in sequence. First time they will do preclinical, then phase 1, phase 2, phase 3, phase 4. So in a series, one after the other. But because of the pandemic, they are doing all these things, but in parallel. That means at the same time, they're doing all these things. Okay, that's why they shortened the time. Not that they are skipping any things that they were doing before. That means they are not skipping the preclinical studies. They are not skipping the phase 1. They are not skipping the phase 2. They are not skipping the phase 3. And phase 2, phase 4 will be done in the future. To give you an example, like the Covaxin, the Bharat Biotech, they have not done, they have not done the phase 3. Okay, they have not done the phase 3. But what they have applied to the government is their platform. That means the way they put the virus into the body is a safe platform. It, it is safe because it has been used before for to develop other vaccines like the rabies vaccine, the polio vaccine. They have used that platform of that is called viro culture. That is the cells that are taken from the kidneys of the green African monkeys. And they take that cell and they have given it to human beings in the last 20 years. So that platform is safe. Whereas the mRNA platform is a new platform. It has never been done before. So the Bharat Biotech says, even though they have not done the phase 3 study, which should be done, they feel that the vaccine is safe, responsive, and efficacious because they have used this platform before and they have safety experience and safety data. So they want the government to look at that safety data and and draw the conclusion that their vaccine is safe. But they have not done the phase 3 studies like the Covaxin, like the mRNA viruses that are in the market now. That is the difference. They also say that their vaccine works because it is a whole virus is there. Even though it is killed, it is the whole virus. So they feel that the immune response, that is the protection that the body develops, will be there because previously when they have used the whole virus like the polio, like the rabies, the body developed the protection. And in the preclinical animal studies and in the phase 1 study, it was safe and it developed adequate immune response. Even though they have not done the phase 3, they have negotiated or they have worked with the government to convince them that because of the pandemic, their vaccine can be taken with phase 1 and preclinical studies based on their previous safety, previous immune response to other viruses with their platform. But the Covaxin, not the Covishield, that is the Oxford virus, they have done all the studies, phase 1, preclinical, phase 1, phase 2, phase 3. And their response is 65% of the people that are vaccinated did not get the disease. So when they exposed 100 people who are vaccinated to COVID virus, 30% of them developed illness. But one point that you have to remember is of the 35, none of them, of the 35, none of them needed to be hospitalized, needed to be placed on a ventilator, and no deaths were there. So three important things: no hospitalization, no ventilator, no death. So, so even though people got the virus, 35% of them got the infection, they were all safe. That means the infection is mild. So that is a very important point that all of us have to remember is even 35% of us, if we get the infection, none of us will be hospitalized, none of us will be placed on a ventilator, none of us will die. So those are the three things. So the Covishield did all the tests, preclinical, phase 1, phase 2, phase 3. But the Covaxin, the Bharat Biotech, they only have done preclinical and phase 1 studies and phase 2. But they convinced the authorities that given their prior vehicle, given their prior vehicle, that is the virus cell, which is a kidney, which is a green African monkey kidney cell, which they used for other viruses, which was safe, um, which elicited good defense system. In this also, they feel that the phase 3 studies will show good results. Okay, so that is the key difference between the Covaxin and the COVID and the Covishield. The Oxford virus went through all the phases of testing that any other vaccine will go through. But the Bharat Biotech one did not go through the phase 3 study, but they feel confident given their prior experience, the safety of the vehicle, and because it's a wholly inactivated virus, given other viruses that have elicited good immune response, and in their preclinical, in their phase 1, in their phase 2, where they had safe and response, both were good. They don't know about efficacy because they did not do phase 3 studies to measure the efficacy. So safety, efficacy, and adverse event surveillance is done in both of those vaccines, but not to the extent that they have done in Covishield. That is the only drawback of the Covaxin virus. They do not have the efficacy and the adverse event. That means number of people who can get sick other than the virus from the vaccine. Okay, next slide, please. Raju, next slide.
Yes, sir.
Okay, no matter, I mean, no matter whether, I mean, even if we are vaccinated, okay, which we should, still we should follow the principles of keeping safe distance from other people and wearing a mask. Obviously, washing your hands, obviously not getting into big crowds like big parties, big marriages. I think we should avoid it for the next 1 year. So we should get vaccinated so that we can protect ourselves, and the disease will have a difficult time to spread, and people who cannot be vaccinated because of multiple reasons, they can be protected. So if we follow vaccination, if we follow the wearing of a mask, if we follow washing our hands, if we follow keeping the surroundings clean and safe, and not uh, gathering in big groups, then we can prevent this pandemic. And as a public service to ourselves and to others, and to make the society safe, I think we should follow all these 9 things. That is, as much as possible, staying home other than for going to work, and for basic doing basic things, then keeping a distance, washing our hands, wearing a mask, not involving in big crowds. All these 9 things on this slide are important for the next 1 year to get a upper hand on this pandemic. So basically, I explained what a vaccine is, how does it work, what are different types of vaccines, how you have to look at Covaxin, how you have to look at Covishield. If possible, for your safety, Covishield is better because of the presence of evidence. But if you do not have it, Covaxin is good. Either way, either one we should get, because because when you get vaccinated, even if you get the virus, you will not be hospitalized. The data says, it's not me. You will not be hospitalized. You will not be on a ventilator, and people, no deaths are there. So that's why it is important to get the vaccine. What can people get? What are the side effects? Side effects are when they give the vaccine, at the site of the vaccine, you can develop redness, you can develop swelling, you can develop pain at the site. And then systemic problems are, you can develop nausea, you can develop vomiting, you can develop diarrhea, you can develop muscle aches, headaches, and joint pains. Okay, muscle aches, headaches, and joint pains. And they last for maybe 1 or 2 days. Okay, and sometimes you can develop swelling in the armpit, that is in the armpit, okay, between the chest and the hand, that's the armpit. You can develop small amount of swelling that is called lymph glands, and they will subside in 1 or 2 weeks. Sometimes, very rarely, okay, and very rarely, okay, people can develop anaphylaxis. That is a serious event. And there are, up till now, there are 2 cases in mRNA vaccines that anaphylaxis developed, but that can be treated. That means the treatment will be hospitalization and giving medications to get a handle on anaphylaxis, and no deaths have happened up until now for people who received the vaccine. So those are the side effects that you can anticipate for the vaccine. These are mRNA vaccines, and they have very minimal side effects. But even in a wholly inactivated virus like the Bharat Biotech vaccine, uh, deaths from the vaccine are extremely rare. They had what is called as transverse myelitis, where people can lose sensation in both lower extremities with other vaccines, but not with this vaccine. And I think with Oxford vaccine, there was one death in Britain, which was unrelated to the vaccine. So that's why they were able to continue the trail. They stopped the trail for a month or two. Then they started it again. So in my opinion, okay, in the reading that I have done for all these different vaccines, there are adverse events. Adverse events means like pain or swelling or redness or nausea, vomiting, diarrhea, muscle aches, and joint pains, headache, fever. Fever is one other thing that I didn't tell you. Fever and swelling of the glands, uh, and anaphylaxis. That means the virus, it is, say, like the mRNA virus or the Bharat Biotech or the Covishield. The virus is packed in a fatty layer, and that fatty layer you can be allergic. Very extremely rare. You can be allergic to that, and that will cause anaphylaxis. And all you have to make sure is wherever you go to get the vaccine, you have to ask them, do they have epifen? That means epinephrine, a medication. If you get anaphylaxis, to give the medication and steroids. If they have those two things, then they can treat anaphylaxis very effectively. Okay, so wherever you go and are getting vaccinated, if you are if you want to be extremely careful, you can ask those two questions. The other thing is, as teachers, you can organize, you can represent your teacher elected representatives to ask to include you as a first line worker, because you are exposed to people who have the virus more than other people. Frontline workers, here teachers are also included as frontline workers. Having said that, if you have, I can answer uh, all of your concerns. See, like even pregnant women, there is no contraindication for pregnant women to have the vaccination. There is no contraindication for people who have immune deficiency disorders. There are no contraindications for people with heart failure, with hypertension, with diabetes, with obesity, not to undergo vaccination. Actually, people with these obesity, heart failure, diabetes, they are more prone to have the coronavirus, and you should get vaccinated. Okay, so Raju, open the floor for them to have to ask any questions.
Yes, sir. Anyone can open, sir.
One at a time.
Oh, for college.
సార్ నమస్తే సార్.
నమస్కారం అండి.
సార్ నేను ప్రసాద్ రావు అండి.
చెప్పండి.
చాలా క్లియర్ గా అందరికీ అన్ని తెలిసాయి సార్. అంటే ఇక్కడ జనరల్ గా ఇచ్చిన ప్రికాషన్ ఏంటంటే 2 సార్లు 2 డోసెస్ ఒకే కంపెనీకి చెందినవి తీసుకోమని చెప్పారు సార్. అది
ఎస్, దట్ ఇస్ ట్రూ. ఇప్పుడు ఉన్న వ్యాక్సిన్స్ లో, ఇప్పటికి ఏ గవర్నమెంట్ పర్మిట్ చేసిన వ్యాక్సిన్ లో అయినా కూడా ఏది mRNA వ్యాక్సిన్ టూ డోసెస్, ఈ కోవాక్సిన్ 2 డోసెస్, కోవిషీల్డ్ 2 డోసెస్. ఓన్లీ జాన్సన్ అండ్ జాన్సన్ ఇంకా రాలేదు. అది ఒక్కటే 1 డోస్ వ్యాక్సిన్ అనమాట. మిగతా అన్ని 2 డోస్ వ్యాక్సిన్స్. ఈ 2 డోసెస్ తీసుకోకపోతే ఏమవుద్ది? ఓకే, 1 క్వశ్చన్. 2 డోసెస్ తీసుకోవాలా? సెకండ్ క్వశ్చన్. 2 డోసెస్ తీసుకోవాలి. 2 డోసెస్ తీసుకోకపోతే 50% ప్రొటెక్షనే ఉంటది. ఓకే, కొన్ని ఇప్పుడు లండన్, ఇంగ్లాండ్ లో, బికాస్ ది వైరస్ ఇస్ సో rampant, the government is thinking of taking a decision to give 1 dose for all the people, because only the amount of vaccine that is available is that much. But they are not so sure. I mean, they are still debating. Right at this time, the right thing to do is to take the 2 doses, and to take the 2 doses for everything. There is a period for, I think, for Covaxin it is 1 month. For mRNA vaccines it is 3 weeks, and for Covishield, no, for Covaxin, for Covishield it is 1 month. For Covaxin, I don't know. I think it is also 1 month. But you have to take the 2 doses. Only time that you don't take the second dose is if you get a serious reaction to the first dose. If you get a serious allergic reaction, anaphylaxis, then you don't. But if you just get a fever, if you get muscle aches, if you get joint aches, if you get nausea, vomiting, diarrhea, pain, then you can take the second dose. That's not a contraindication. That's not a thing not to take the second dose.
2 times ఒకటే తీసుకోవాలి కదా సార్? అది మెయిన్.
ఒకటే తీసుకోవాలి. yes, ఒకటే తీసుకోవాలి.
ఓకే సార్, థ్యాంక్ యూ.
ఎందుకంటే ఈ టూ డిఫరెంట్ వ్యాక్సిన్స్ హావ్ డిఫరెంట్ మెకానిజమ్స్. మీకు చెప్పినట్టుగా ఇప్పుడు ఫర్ ఎగ్జాంపుల్ కోవాక్సిన్ తీసుకోండి. అదేంటి, హోల్ వైరస్ ఈజ్ ఇన్యాక్టివేటెడ్, అంటే డెడ్ వైరస్. ఓకే, కోవాక్సిన్. Covishield తీసుకోండి. Covishield is a vector vaccine. అంటే దాని vehicle that they give the vaccine that enters your body, the coronavirus part of the DNA is taken and it is inserted into a adenovirus. Okay, and that is given into your body. So one is a adenovirus, the other is a wholly inactivated coronavirus. So those are two different things. Okay,
Yes.
అందుకనే ఒకే వ్యాక్సిన్ 2 సార్లు తీసుకోవాలి.
Sir, good evening, sir. I am Srinivasu.
Go ahead, sir. Yeah, go ahead, sir.
Sir, with how much gap you have undergone these 2 doses, sir?
See,
Is
for
it
each
Pfizer?
virus it is different. For the mRNA vaccines, that is the Moderna and the Pfizer, it is 3 weeks.
Okay,
But for
sir.
Oxford, I think it is 4 weeks. Plus or
Yes, sir.
minus 2-3 days. Plus or minus 2-3 days.
Okay, sir. Anyhow, in India, they have announced that second dose will be after 1 month, sir. They have announced.
Yes. For each vaccine, it is different. As I said, for the Covishield, okay, Covishield means Oxford virus, I think 1 month. And for Covaxin also, I think 1 month.
Yes, sir. Yes, sir. It is written as 1 month, sir.
Yeah.
For both vaccines, because these 2 are approved by India, government of India.
Yes. Yeah, these are called emergency use authorization, EUA. Okay,
Sir.
emergency use authorization. See, the reason it is called emergency use authorization is phase 4 data is not there for any of these vaccines.
Sir, what is the time frame for vaccination in USA, sir? Is there a time
Again,
frame?
again, it's the same thing. After the first dose, the second dose is for 3
No,
weeks.
sir. No, sir. So in India, what they have announced that 30 crore first priority will be given to healthcare and frontline workers.
Everywhere it's the same thing. First priority is to healthcare workers. That's why I was able to get. The second one will be healthcare workers and elderly people in USA. Healthcare workers and elderly. The second will be a little higher risk, and the third will be the general population.
Sir, in India, they have announced that 3 crore healthcare and frontline workers will be vaccinated. So followed by 20 crore people, that means more than 50 years age, sir. So they have
Yes.
given that announcement they have given. So
Yes.
less than 50, more than 2 illnesses or diseases at same time.
Yes.
So they have fixed the target as July end, sir. July end of July. That means by August 1st, they wanted to start for remaining people, sir.
It can be similar also in the US. It may take that amount of time.
Sir.
Because the companies cannot make more than 25 million a month. So there are 2 companies up till now, 50 million a month. So if 50 million a month, they have to vaccinate it twice. So 25 million will be covered every month. The population is about 300 million. So you have to calculate that. And in 1 or 2 months, there will be another 2-3 companies that will come.
What about Sputnik, sir?
Which one?
Sputnik
Sputnik is a Russian vaccine, and there is another Chinese vaccine. Again, those vaccines also have the same problems as Covaxin. They have not done phase 3 trials.
What about success rate, sir?
Again, success rate is when they have not done phase 3 trials, you do not know the success rate. See, success is how many people are vaccinated and how many people got the coronavirus of the people that are vaccinated. Suppose I give you vaccine and I expose you to coronavirus. Success is if you don't get it. That is 100% success. If you get it, then in the 100, it will be 99. And another person get it, it will be 98. Like that. So wherever there is no phase 3 trial, you cannot get you cannot get a efficacy percentage. You cannot get a success percentage. See, the Chinese vaccine, the Sputnik, the Covaxin, they do not have the efficacy studies. They do not have phase 3 trial.
But no vaccine has claimed around 100% assurance, but Covaxin and Covaxin, Krishna Yalla, he is claiming that it is 100% safe. Covaxin.
No, you're mixing things. See,
Sir.
you're mix. See,
Adanle,
in vaccine,
class
no,
time
in vaccine, you have to.
మాట్లాడతారు సార్తో ఏమన్నా
In vaccine, you have to have three things: safety, immune response, and efficacy.
Yes, sir. Yes,
Okay,
sir.
Covaxin and Sputnik, they do not have the efficacy result because they did not have the phase 3 trials. Okay, they are safe, but they have no phase 3 trials.
Thank you, sir. Thank you. Almost we got every point about from that spike to that means what are the things about vaccination development and also various phases. So all those things we got idea, sir.
Yeah, thank you, Srinivas garu.
సార్ ఇట్స్ ఎంఎస్ సార్
MS garu, namaskaram andi, cheppandi.
సార్ మీరు ఇచ్చిన ప్రెజెంటేషన్ అంతా బాగుంది సార్. యాక్చువల్గా బయాలజీ బ్యాక్గ్రౌండ్ ఉన్న వాళ్ళకి బాగా అర్థం అవుతుంది సార్. నెక్స్ట్ సార్, మీరు ఈ కోవాక్సిన్ phase 3 ట్రయల్స్ అవ్వలేదు కదా సార్ మన ఇండియన్ బయోటెక్ కంపెనీ? అవ్వలేదు. మీరు మాకు పర్సనల్ గా సజెస్ట్ అంటే ఆక్స్ఫర్డ్ వ్యాక్సిన్ బెటరా, ఈ వ్యాక్సిన్ బెటరా సార్?
అంటే మనం సైంటిఫిక్ ప్రిన్సిపల్స్ తీసుకుంటే మనకి ఆక్స్ఫర్డ్ వైరస్ అంటే కోవాక్సిన్ వైరస్ గురించి phase 3 ట్రయల్స్ చేశారు. ఈ మన భారత్ బయోటెక్ వ్యాక్సిన్ కోవిషీల్డ్ కి phase 3 చేశారు. భారత్ బయోటెక్ కోవాక్సిన్ కి phase 3 చేయలేదు. అంటే ఏంటంటే భారత్ బయోటెక్ ది డెఫినెట్లీ సేఫే. రెండు, వాళ్ళు చేసిన 1000 మందిలో యానిమల్ స్టడీస్ కి వాళ్ళకి ఇమ్యూన్ రెస్పాన్స్ అంటే మీరు దొంగవాడిని పంపించినప్పుడు పోలీసులు రావటం అనేది ఉన్నది. పోలీసులు ఉన్నారు. ఓకే, బట్ ఆ పోలీసులు ఆ దొంగవాడిని ఏది సబ్డ్యూ చేస్తారా, లేకపోతే ఆ దొంగవాడిని దొంగతనం చేయనివ్వకుండా చంపకుండా ఆపుతారా అనేది వాళ్ళకి ఈ స్టడీలో లేదు. ఓకే, మిగతా వ్యాక్సిన్ స్టడీస్ లో వాళ్ళకి ఆ పోలీసు వాడిని దొంగవాడిని చంపటం లేకపోతే దొంగవాడిని అదుపులో పెట్టడం అనేది వాళ్ళు సక్సెస్ఫుల్ గా ఏది చూపించారు. మిగతా వ్యాక్సిన్ స్టడీస్ లో లైక్ ఫ్లూ వ్యాక్సిన్ మినిమం 50% ఉంటే గానీ అప్రూవ్ చేయరు. ఇది కొన్ని వ్యాక్సిన్స్ కి 95%, 98% ఉన్నాయి. ఓకే, సో మీకు అది సేఫ్, మీకు అది ఇమ్యూన్ రెస్పాన్స్ ఇస్తుంది, బట్ ఎంత పర్సంటేజ్ ఆఫ్ ద పీపుల్ కి జబ్బు రాదు అనేది తెలియదు. ఓకే, వేరాస్ కోవిషీల్డ్ కి 70% తెలుసు. ఓకే, మీకు అది ఆన్సర్ చేశానా ఎంఎస్ గారు? అంటే మీరు అడిగింది ఏంటంటే మీకు 2 ఆప్షన్స్ ఇస్తే మీ దగ్గరికి ఇద్దరు వస్తే నేనైతే ఈ టైంలో కోవిషీల్డ్ ఆక్స్ఫర్డ్ తీసుకుంటాను నేనైతే ఈ టైంలో. బట్ నాకు ఒకే ఆప్షన్ ఉండి నాకు కోవాక్సిన్ ఇస్తే కోవాక్సిన్ తీసుకుంటాను. ఒకే ఆప్షన్ ఉంటే ఎందుకు? వ్యాక్సిన్ తీసుకున్న వాళ్ళందరికీ కూడా ఎవరికి హాస్పిటల్కి వెళ్ళాల్సిన అవసరం రాలేదు, ఎవరికి వెంటిలేటర్ పెట్టాల్సిన అవసరం రాలేదు, ఎవరు చనిపోలేదు. ఓకే, సో ఆ 3 బట్టి నేను ఏదో ఒకటైనా తీసుకుంటాను. 2 ఉంటే ఆక్స్ఫర్డ్ తీసుకుంటాను.
ఓకే సార్, థ్యాంక్ యూ వెరీ మచ్.
ఓకే, థ్యాంక్ యూ.
Sir, good morning, sir. This is Ed Kondalu from Hyderabad, Chintal branch principal, sir.
Yeah, go ahead, sir.
Yes, sir. Basically, sir, about the vaccine, sir. Below 18 years, children, they don't want to take the vaccine, it seems, sir. Because I have two children, age of 7 years and 3 years. So what about the vaccination process for them, sir?
Extremely good question, Edkondalu garu.
Sir, sir.
ఇప్పటికి ఉన్న వ్యాక్సిన్ కంపెనీస్ అన్ని కూడా ఎక్సెప్ట్ ఫైజర్ ఒక్కటే 16 ఏళ్ల నుంచి టెస్ట్ చేసింది, 16, 17 అబౌవ్. మోడర్నా ఒక 18 ఏళ్లకే. ఆక్స్ఫర్డ్ కానీ భారత్ బయోటెక్ కానీ ఎయ్యి కూడా 18 ఏళ్ల కన్నా కింద వాళ్ళని టెస్ట్ చేయలేదు. ఓకే, సో ఇంకా కొద్దిసేపు ఆగటం బెటర్ చిల్డ్రన్. ఓకే, టెస్ట్ చేస్తున్నారు ఇప్పుడు 12 ఏళ్ల దాకా వచ్చినట్టున్నారు ఫైజర్. బట్ నన్ ఆఫ్ ది available vaccines that you have, I don't think they are tested in children, if to my knowledge.
Sir, Edgondu garu.
This is Satish sir from Hyderabad. Before going to vaccination, we are required to go for test, sir, COVID test, or directly we can take, sir.
No, you are not. You do not need to take COVID tests. Okay, even for people who have COVID, and నాకు కోవిడ్ వచ్చినా కూడా నా న్యాచురల్ గా వచ్చిన డిసీజ్ కి జరిగే యాంటీబాడీస్ ఎక్కువ కాలం ఉండవు అని 90 days తర్వాత వాళ్ళకి వ్యాక్సినేషన్ తీసుకోవాలి. సో there is no need to test for antibodies. There is no need to test for COVID tests. Okay, as long as you do not have fever at that time, no coughing at that time, and మీరేమి బ్లడ్ థిన్నర్స్ మీద లేనంత కాలం, ఓకే, మీరు కోవిడ్ వ్యాక్సిన్ తీసుకోవచ్చు.
Thank you, sir.
సార్, కాలేజీ నుంచి ఇంకెవరన్నా మాట్లాడతారా సార్? ఇంటర్మీడియట్ కాలేజ్ నుంచి. సార్, ఆదినారాయణ గారు, మీరు ఏదో మాట్లాడదాం అనుకుంటున్నారు. సార్, వాయిస్ వినపట్టలేదు సార్ ఆదినారాయణ గారు. సార్, వినపట్టలేదు సార్. నా వాయిస్ వినపడుతుందా సార్?
యా, వినపడుతుంది రాజు.
రామాదేవి మేడం.
Sir, responding, sir.
Yeah,
Sir,
namaskar.
good evening, sir. Very good evening, sir.
Good evening,
Sir,
madam.
how are you, sir?
Fine, thank you.
My question is, still we didn't have any idea about the new strain of corona, sir. If our either Covishield or Covaxin, is it useful to prevent that new strain also, sir?
Okay, the new strain is called B117. Okay, when you mean a new strain, what it means is the coronavirus generates 27 proteins. And in the spike protein, which is what like a fingerprint, mana elmudra laga, a spike protein, the spike protein, there is some variation in the protein structure. Two variants are seen. One is called NY501. The other is called GD614, I think. Those are like, suppose you take your lock, okay, home lock, okay, the door lock, and you have a key, okay. Sometimes it is easy to open the door, open the lock, okay. Sometimes you have to maneuver a little bit. That over a period of time, a little bit of damage will be done to the key, okay. So you have to use a little force or little different technique, okay.
Yes.
To open the lock. Just like that, when you have a variant, okay, it is called a mutant. Up till now, all of these vaccines are effective against the new strain. All of the vaccines are effective against all the known variants, okay, known mutants. It's called mutation. Your biology, okay, you understand.
Yes, yes.
Mutation, okay. Only doubt they have is a South African mutant that in some studies have shown a little resistance. But again, None of them have been hospitalized. None of them have been requiring a ventilator, and no deaths. The Bharat Biotech, the Covaxin says,
Yes.
at least the company chairman says that because it's a wholly inactivated virus, okay,
Yes.
it will be more effective on the mutants compared to other vaccines. That is his theory. Okay, no proof. Okay, his theory is because it's a wholly inactivated virus, it will be more effective on the mutants.
Okay.
Okay,
Okay. Thank you, sir.
thank you.
Thank you.
Sir, Chaitanya, sir. Sir, Chaitanya, sir. Sir, Chaitanya, sir. Sir, Pani. Anyone from engineering college? Sir, anyone from intermediate college?
Are there any more questions from anybody?
Sir, Adinaran garu, చెప్పండి sir. సార్ అజ్ఞాన్ గారు మీ వాయిస్ వినపట్లేదు సార్.
He can type into you, Raju.
Sir,
He can type into you if there is availability. He can send a message and you can ask.
ఓకే సార్. సార్ ఈలోగా ఎవరైనా ఉంటే మాట్లాడండి సార్. ఎవరైనా మాట్లాడండి.
Yeah, good evening, sir.
Good evening. Good evening.
I'm Kishore from Hyderabad, sir.
Yeah, go ahead, Kishore.
Suppose I got vaccinated. I am speaking to the other person who did not get vaccinated. Will he be affected or he is secured, sir?
Okay. See, suppose today you got vaccinated, okay? There is every possibility that 2 days ago or 3 days ago, before you got vaccinated, you probably, you can get coronavirus. And it will take at least minimum of 4 to 5 days from the time you are vaccinated where you are susceptible, so you can get the coronavirus. So that means it is only you are protected after 4 or 5 days. If you get the virus after that, your chance of giving it to the other person is less compared to if you are not vaccinated. But still, you can transmit. Still, you can transmit if you get the coronavirus. And for if you are exposed to the other person who has the coronavirus, within the 4 days of you getting vaccinated, you can get the virus. And after that, you can get, before the second vaccine, you can get 50% of the times you can get the virus. So it is important that you wear a mask, and still it is important that you put a distance between him and you. Did I answer, Kishore, or you have a doubt on that?
Exactly, sir. Thank you. Thank you, sir.
Huh? Okay.
Exactly, I got the point.
Okay, thank you.
Sir, Rambabu garu.
Sir, good morning, sir. Good evening, sir. This is Chaitanya, sir.
Yeah, Chaitanya garu, go ahead, sir. Tell me.
Thank you very much for valuable information, sir.
Thank you.
Already I took the, just now I saw all the PPT slides also, sir. We will educate the parents also, sir.
Thank you. That's a good public service that we all should do.
Yes, sir. Thank you, sir.
Sir, just now I have sent to all the people.
Yeah.
Sir, anyone wants to talk?
ఓకే సార్, ఇంకెవరైనా ఏమైనా డౌట్స్ ఉంటే సార్కి మెయిల్ పెట్టండి ఏదన్నా క్లారిటీ కోసం. థియరిటికల్ గా చదివాం కానివ్వండి, మీరు చెప్పిన తర్వాత క్లియర్ వచ్చిందండి మెకానిజం కానీ ఇవన్నీ కూడా. థ్యాంక్ యూ సో మచ్ సార్. మీరు చెప్పినట్టు ఫ్రంట్ లైన్ వారియర్స్ లో టీచింగ్ అండ్ నాన్ టీచింగ్ స్టాఫ్ ఆఫ్ ఆల్ స్కూల్స్, కాలేజెస్ అండ్ యూనివర్సిటీస్ జాయిన్ చేయండి అనేది ఒక దీని రిప్రజెంటేషన్, తర్వాత దానికి సంబంధించినటువంటి ఇది అందరినీ కూడా కలిసి చెప్తాం సార్ గట్టిగా.
Yeah, మీ representatives, మీ టీచర్ ఎలక్టెడ్ representatives కి మీరు you have to convey why you are a frontline worker.
Yes, sir.
Okay, that's important thing for them to represent you.
Yes, sir.
Sir, 1 second, sir. Vijay sir, Master.
Good evening, sir.
Good evening, Vijay.
We all get clarity about this vaccination. My final doubt is.
Sir, కొంచెం disturbance వస్తుంది సార్ చూడరా.
Sir, is it okay?
No, lot of disturbance, Vijay.
Sir, am I clear, sir?
Yeah, or you may go on the audio call, or I mean, yeah, you are clear now.
About vaccination, we got clarity, but the final doubt is, if the person is vaccinated, for how many days that vaccine is having the capability of producing antibodies in our body, sir?
Okay, Vijay, that's a very good question. Up till now, none of them have the data because even since they started the study, it is not more than 6 months. So up till now, they only have data for 6 months at the most. Okay, they don't have data more than that as to how long the antibody will last. Usually, for any of these vaccines, at least it will be a minimum of 1 year, as long as the mutants do not develop. That's why they vaccinate for the flu every year, because there is a lot of mutation in flu virus. If there is no there are no significant mutations, it will last more than a couple of years at least. But if the mutations are there, okay, very significant mutations are there, then we may have to get vaccinated every year. But right now, the data is not there.
One more doubt, sir.
Yeah, go ahead.
When I just met with these people who are doing this vaccination for the third phase of vaccination, the trials, so they advise me that if the body, if you already infected with the coronavirus, then you are not eligible for a trial phase of third phase. If thing is already your body may have antibodies, so you are not eligible. Officially said that you are not.
Okay, that is not a correct information, Vijay. Whoever developed coronavirus, after 90 days, it is recommended for them to take the vaccination, even a little bit before. But it is a strong recommendation that they have to take the vaccine.
Even our body have produced antibodies, even then we can take vaccination.
Yes, when you get natural infection, you will have to wait for about 90 days and then take the vaccine.
Okay. And the thing is, to get the result, I think what they said is on the first attempt, that is first dosage, they will give, and after 28 days, they will give the second dosage. And from then, for all 8 months, means every month they are going to scrutinize the things that what is happening in our body. And after that, they said that after the next 4 months, through the phone, we can get the information, that is what is the condition of the body. So will it take 12 months to get the results in that, right?
Yeah, see, for vaccinated people, first dose today, second dose after 4 weeks. After 4 weeks means plus minus 2-3 days, and then the body is protected. For people who got infected with the coronavirus, after 90 days of the infection, you have to get vaccinated.
So overall, to get the result, we have to wait for 12 months. Means the complete result of the third phase.
No, you don't have. See, if I get coronavirus today, after 90 days, I'm supposed to take the vaccination for my protection. Okay. And as to how long the vaccine lasts, right now, as long as there is no mutation, I don't have to worry. But if there is mutation, then every year I have to take a vaccination. For that, the jury is not out. For that, there are no studies. Thank you.
Sir, Chaitanya sir. Hello,
రాజు
Chaitanya sir.
ఇంకెవరైనా ఉన్నారా?
ఇంకెవరు లేరు సార్.
సార్ అందరు ఇంకెవరన్నా ఏమైనా డౌట్స్ ఉంటే సార్కి మెయిల్ చేయండి, లేకపోతే రాజు చెప్తే రాజు ఫార్వర్డ్ చేస్తారు. సార్ థ్యాంక్ యూ సో మచ్ సార్ ఫర్ ఎలాబరేట్ ఎక్స్ప్లెనేషన్ అండ్ ఎవ్రీథింగ్. చాలా విషయాలన్నీ కూడా క్లియర్ అయినాయి సార్. బిలో 18 years ఇవన్నీ కూడా కిషోర్ గారు అడిగింది మిగతావి. థ్యాంక్ యూ సార్. మీ అందరం కూడా మీరు చెప్పిన పాయింట్స్ చేసి అందరికి చెప్తాం సార్.
ఓకే, థ్యాంక్ యూ.
Thank you, and thank you all of you.
Thank you.
అందరికీ కూడా సంక్రాంతి శుభాకాంక్షలు కూడా అండి.
Yeah, thank you, sir.
NRI group.